Okay, we are streaming on Facebook now, so we are going to begin. Give me 1 second. So good morning to everyone who is registered and joining us from near and far. We are incredibly excited to have you join this very important conversation about legacy asbestos in general. What is it? Where is it? What do we do? And Greg and I were speaking this morning. And even more importantly, it's what does the government need to do to keep us safe? We have folks that are joining right now, all attendees. Okay, so let me start. Basic housekeeping, there is an agenda. We will stick to it as much as possible. I also want you to know that we read every single one of your questions, and there are more than we can actually read and answer individually. So we have reviewed them intently, and we will ask general. Hey, Raja. Hey, Dr. Flores. So he's on. Okay. Now we can officially start. Dr. Flores, good morning to you. I think Raj is there. Okay, so good morning. We're just about ready to start our webinar. This is our 13th webinar that ADAO has done. And this is focused on legacy asbestos. The common questions that we answer when we go to Washington or at our conference is what is it, where is it, what do we do? And more importantly now, it's what should the government be doing? And you're going to hear from our experts today talking about different aspects of asbestos. And can you see my slides? Yes, okay, great. This could really be titled Everything, Everywhere, All at Once, because if you've been following ADAO and others, the last 3 months, we've been hit with many landmark step forward with 2 rules and a draft risk evaluation for legacy. But what this has created for ADAO and others is a keen interest in what do we need to do, and there's a lot of terminology, but there's a lot of confusion. So today we're going to dismantle confusion. I brought together the leading minds of people that can truly listen to your questions and answer them. We each have 5 minutes or so to go through various points. And this will not be the only webinar that we do, especially about legislation and new regulations. But we're very lucky to have Dr. Raja Flores and Dr. Wu join us. Very quickly, for those of you who don't know ADAO, for 20 years, we've been working on education advocacy and community efforts. And no, we do not represent any law firms or make referrals. However, we're deeply grateful to 4 firms that do support our work, and they ask for nothing in return. Simmons Hanley Conroy, the Gorey Law Firm, Motley Rice, and Early Lucarelli, Sweeney, and Meisenkone allow us to put on conference and really educate the public. Today, you're going to hear us talk about 6 main areas. You're going to hear from Dr. Flores and Dr. Wu, and they're going to bring in the health-related aspects of asbestos exposure to their different areas of expertise. Of course, Brent will talk about legacy asbestos, Greg about federal legislation, and Bob, an expert about EPA regulations. And yes, we will have time for Q&A. There's a resource page made, and Stephanie are happy to share this link after the webinar. Many of the different papers, studies, aspects of regulatory efforts will be on this resource page. So good news for you, you don't have to write as fast as I talk, and this link will be sent to you along with our thank you. Before we start, ADAO's tradition is remembering, normally it's an asbestos victim, but today I want you to read and hear David Eagleman's name, but more importantly, know that he was a leading advocate in truth and science and public health. And David passed away just recently, but he used science to fight the industry's propaganda. And we will seriously miss Dr. Eagleman. Now, we shouldn't even be having to discuss this. It's a 100-year-old problem. Asbestos has been known for literally over a century. It's a carcinogen, no safe level, and nearly 70 countries have banned it. But this is what we're up against. This was a quote from American Chemistry Council chlorine panel, and they're claiming chrysotile asbestos diaphragm technology is being used safe by the chlor-alkali industry. You're going to hear the physicians and the experts talk today. That will be refuted, but more importantly, we have to deal with legacy, which is in homes, schools, buildings, and workplaces. And Greg and Dr. Wu know very well after natural disasters, whether it's fire or even the tornadoes that just hit, when structures are contaminated and then they either implode or need repair, that's cause for many times exposure. We're talking about a nearly invisible fiber. Again, these resources will be on your page. You can see 20,000 fibers compared to grains of rice in human hair. ADAO is all about prevention, and we work very closely with IAFF and EIA, Brent, Environmental Information Association. We want people to understand the threats that asbestos can cause and really what to do. And that's it on the slides, but really I want you to take this opportunity to write down your questions and get back to us if we don't answer them. So as we start, and Dr. Flores, when you hear me cough terribly, just know I'm getting over respiratory junk. You'll probably want to give me medication. Let's start with self-introductions before we start the program itself. Greg, you're in my top left corner. Can you please introduce yourself, your name, what you do, kind of why you're here?
Good afternoon to the folks on the East Coast. Good morning to those on the West Coast. My name is Greg Russell. I am a retired firefighter, spent 33 years in uniform, and for about the last decade, I have been an advocate for firefighter issues on Capitol Hill. So why I'm here is my brothers and sisters are suffering cancer from horrendous rates. It's the #1 killer of firefighters, and we must arrest that statistic and reverse it. I'm sure my colleague, Dr. Wu, will be able to add upon that notion there, and I'll pass it to him for his introduction.
Sorry, I'm battling technology issues here. Good morning, everybody. My name is Dan Wu, and I'm the Chief Medical Officer for the International Association of Firefighters. I work with Greg, as he has already mentioned. I'm a retired firefighter and medical doctor with a master's in public health. Having spent 30 years in the fire service and EMS, 32 years as a FEMA search and rescue doctor, and I'm going on my 24th year as a physician. I have very, very biased interest in the health of and safety of firefighters because I was one and a lot of my friends and colleagues are still in the fire service. So it baffles me that unnecessary exposures to carcinogens, toxins, and other things that hurt us are still allowed to be utilized for the benefit of profit. So that's the motivation for my being here. Thank you.
Thank you, Dr. Wu. Dr. Flores, could you introduce yourself?
So I'm Roger Flores. Sounds like I need a bronchoscopy also, Linda. I'm a thoracic surgeon at Mount Sinai Medical Center in New York City. I cut out a lot of cancers from these exposures, asbestos, etc. We also work together with the first responders here at Mount Sinai. So a lot of my patients are firefighters, and they are one of the most compliant, non-complaining patients that I have. They are basically, doc, do whatever you got to do. And, here are these guys that, they run into a burning building when everybody's running out. And I hate seeing them suffer from this high rate of cancers than anybody else, where they need these big, debilitating operations that take these big, strong, most of the men, and really make them vulnerable, make them feel like they're in a position where they're so used to taking care of their families. Now they're in a position where they're weakened and they it doesn't just affect them physically, it affects them emotionally, psychologically, and it's painful to see for something that's actually preventable. So I've always said, if we can stop this contamination of human beings by asbestos, then it's our duty to do so. Congress, by passing legislation, can save more lives than I ever could with my knife. And I continue to say that. And I think the stuff that Linda's doing is nobody else doing it. And this is one woman who's just a pissed off widow, who's made such ground breaking advances to get something very simple. And it's a no-brainer passed. It's the right thing to do.
Dr. Flores, thank you for your kind words. It takes a village, and we're all in this village together. Brent, please introduce yourself and why you're here.
Thank you, Linda, and welcome everyone from both good afternoon and good morning. I am Brent Kynoch. I'm the Managing Director of the Environmental Information Association, or EIA. EIA is a nonprofit membership organization made up of professionals who are involved in the asbestos abatement industry. We were founded in 1983 as the National Asbestos Council. And over the years, we grew to become involved in other environmental contaminants and concerns, and that's when we changed our name to the Environmental Information Association. We are delighted to work with the Asbestos Disease Awareness Organization as a technical resource when they are out trying to push their message of prevention and advocacy. And we've been involved with ADAO almost since their founding, and we will continue to support the efforts and the message that ADAO brings forth.
Thank you, Brent. Bob, can you introduce yourself, please?
Yeah, I'm Bob Sussman, and I'm an environmental and public health lawyer with, I'm afraid to admit this, about 50 years of experience. I spent a considerable amount of time at US EPA in two different administrations, and much of my time and effort over the last several years has been devoted to serving Linda and ADAO as Linda's counsel. And it's been an amazing run for both of us. There have been, I think, huge legal challenges, huge regulatory challenges, and as I think Roger said, ADAO is doing work that nobody else is doing, and we have been right at the center of all of the many policy and legal issues, and those issues are still coming at us in full force, as you'll see from our presentations today.
Thank you, Bob, and thank you for all your great work. To talk about asbestos, to be honest with you, after the penny slide and seeing what industry writes, I don't think we have to talk a lot. I just want to dial one thing into focus. For EPA's Part 1, Part 2, asbestos reporting, and the Reinstein Ban Asbestos Now Act that Greg will touch on, the definition of asbestos is what is in TSCA under the AHERA Act, which is managing asbestos in schools. To be clear, it may not be a perfect definition for some, but it has regulatory standing. So we talk about asbestos, we're talking about all 6 fiber types: chrysotile, chrysotile, amosite, anthophyllite, tremolite, and actinolite. And yes, they are considered the asbestos form varieties. We don't want to dispute the science. Raja wants to put down his scalpel, and Dr. Wu wants to go back to IAFF and says his members are safe and free of contaminants. So I don't want to dig in too much to the definition. I just want you to be aware when Greg speaks about Part 1 or RBAN, the fiber types are important to know. There's 6. And that's all I'm going to say about asbestos. A known carcinogen, claims the life of 40,000 Americans every year. These are preventable diseases, and there's no safe level, as my earlier slides showed. Dr. Flores, I'd like to flip this webinar over to you because I think early warning symptoms, diagnosing treatment, and you do something very unusual, which I absolutely love. You care. You care for the patient and the family, and that goes outside of your thoracic surgeon duties. But your level of knowledge as to what goes into diagnosing, treatment, and caring is huge. Can you spend some time talking about what you see at Mount Sinai and also your 9/11 experience also? The floor is all yours, Dr. Flores.
Sure. So everybody does care. The problem is that they don't know what to do with it. Most people believe that asbestos is banned and that asbestos is illegal. Everybody knows that. They see the signs, but somehow it hasn't gotten out to the public that asbestos is still being imported. They found it in crayons, they found it in makeup, you got the chloroalkali industry. It's still being imported. And people think asbestos is banned when it's not. So there's misinformation out there that needs to be corrected, that needs to be disseminated, because everybody does care. Nobody in their right mind wants to see a firefighter hurt. Like, if you had to choose one profession that in this divided world we live in, everyone respects the firemen. It's just, they can't do any wrong. And I don't think regular people want to see firemen hurt. Now, asbestos is ubiquitous. It's all over the place. And, you at least need to know what's in there. If you're a fireman coming into some building in New York City, you want to know, okay, this is asbestos. Now, then it's your choice. I'm not going to wear this. I'm not going to wear that. It's like that one guy, I forget his name, the guy that died that was down in 9/11, Alvarez, I think his name was. He goes, and even if they did tell us the air was contaminated, we would still have gone down there. And that's the type of people that we're dealing with. These guys are salt of the earth. And now when they come into my hospital, when I see them in my office, they have been beaten down, right? Because most of the time, if they have a symptom, whether it's shortness of breath, chest pain, or something, they sort of push it aside. I mean, I remember when I used to cover the emergency rooms, we had a fireman in who was in the fire. He just had a burning 2x4 fall on his head. Hey, doc, just throw a Band-Aid on it. I got to get back to the fire. That's the way these guys are built. And when they come in and I see them short of breath, they've lost 40 pounds, they're not feeling good. And many times when their family leaves the room and it's just me and them one-on-one, they will frequently break down crying. And it breaks your heart when you see these, just courageous men crying because not just the thing, but like I said before, the emotional, something gets taken from them when they are suffering like this. And it is something that, and they're suffering from it, from something that is preventable. And that's the hardest thing. So they come into my office, short of breath, this or that. We got to get CAT scans on them. We got to get PET scans. We got to do biopsies. Just a regular biopsy, you're invading them. You're cutting into them. You're putting instruments into them to get this biopsy. Then you find out they got this cancer, whether it's mesothelioma, whether it's lung cancer, esophageal cancer. You find out they have this cancer. And that's a frequent thing that's found in patients who are down in 9/11. Higher rate of cancers. Throw firemen on there, even higher rate of cancers. And then they need these big surgeries. Also, they're getting chemotherapy, they're getting radiation, they're getting knocked down. And like I said, these are some of the strongest, not just physically, but emotionally, spiritually, human beings that we have. And these cancers are just beating them down. And the thing that upsets me the most is it's preventable. So, we want to prevent 30 years from now, the people that are going to be saving our kids' lives. We want to prevent those firefighters from getting affected now, because it's the exposure now that's going to kill them 20, 30 years from now. And so, you know, yeah, we may be off the planet by then, but our children need these people to fight for them. Our children need these people to protect them when their building's on fire. So if you could see what I see and see how many measures are taking to treat so many of these patients, painful procedures, not just to diagnose, but to treat. And then many still end up dying regardless. But it's seeing them get broken down over a period of 1 to 2 years where they just basically shrivel up, and it's preventable. I wish I could take the people from Congress. Is probably the only thing I would ever do with them. Have them come walk with me in the hospital, from the operating room where we got someone's chest cracked open, to the patient suffering upstairs that's walking around, to the other building where we have the end of life care, where you're seeing that patient lying there with their family members all around them. And they would know, they would realize this is not partisan. This is not, you know, anything financial. This is just the right thing to do. But it's so hard to get the message out because there's been the false message that asbestos is not an issue, that asbestos is safe, that asbestos is this or that, because people are saving money by creating that narrative. So it's the usual thing, money versus health. And right now, it just seems like money has won. I mean, we're preaching to the choir here. All of us believe all this. That's why we're here. But there's so many people out there that don't. And they're hiding in the shadows, and they're, you know, getting out misinformation. So it's important that we have Linda over here, you know, getting out the real information. So if there's anything we can do to disseminate the truth, we got to do it.
Thank you, Dr. Flores. Dr. Wu, I put your testimony on the resource page, the one that you gave to the EPW committee. I think that was last year. Can you share from your important position with IAFF and your experience, tell us a little bit about asbestos exposure, how it impacts your firefighters, the studies that you refer to, and what you see as a chief medical officer, please.
Sure. But first of all, thank you, Linda, for putting together this webinar. And so we can talk about this important health topic. And thank you to Dr. Flores and everyone else here for what you do to help firefighters. So those here today that are firefighters know that cancer in firefighters is an epidemic. It is actually the leading cause of line of duty deaths. And 2/3 to 3/4 of all the deaths that we honor every year at our fallen firefighter memorial are due to cancer. So there are numerous studies that show that firefighters have a significantly higher cancer incidence than the general population. And many of them have shown that asbestos is the cause of it. So as Linda mentioned, asbestos is a proven carcinogen, and that's not her or me saying it. It's classified as a known human carcinogen by the U.S. Department of Health and Human Services, by the EPA, by the World Health Organization's International Agency for Research on Cancer. So at any emergency where asbestos is present, its fibers are going to become airborne, and they're going to be inhaled by firefighters. Or, if not inhaled, these fibers are going to settle on our skins, gear, equipment, and apparatus. And when we go back to the firehouse, we'll unknowingly bring this killer back with us and silently and continuously continue to re-expose ourselves, or we will also expose our coworkers. And when we get off shift and we go to our homes, we'll transfer the depositors of asbestos fibers in our footwear, uniforms, skins, hair, to our homes, and then we'll expose and continue to re-expose our families to this deadly carcinogen. So it's easy to see that asbestos is the gift that keeps on hurting. So as a retired fire chief, I know that any emergency of any magnitude that disturbs structures in any way is a potential asbestos exposure. And as a FEMA search and rescue doctor, I've experienced this on a massive scale at 9/11, which was the largest asbestos job in the world. So while the tower stood, their asbestos was allegedly safe, but then the attack happened. And just like that, 100,000 plus rescuers, including me, and over 500,000 New Yorkers, including children, were exposed to the 400 tons of pulverized asbestos that was aerosolized. So everyone within a 1.5 mile radius was exposed. And because OSHA's safe level of asbestos is actually 0, every single exposure makes firefighters and everybody else more likely to develop the lethal asbestos-induced diseases. So to me, knowing this, being common knowledge, it's deeply troubling that asbestos continues to be used in the United States. Greg is going to touch more on this, but thankfully, the Reinstein Ban Asbestos Now Act, being championed by Linda, is fighting to change this. And given the clear medical evidence that establishes causation between asbestos and cancer, you would think that would be an easy fight. But history has proven us otherwise, unfortunately. So Linda mentioned 70 nations already know what we know, and they've banned asbestos. Sadly, the US is not one of them, so let's fix that. It costs more than 40,000 Americans their lives, as Linda shared with us. So passing this act will right that wrong. And that is why the IAFF wholeheartedly supports it, as Greg will expand on in a bit. So I was asked to talk about a little bit about legacy asbestos, because it is currently ignored, as currently the EPA focuses only on asbestos as present uses. But we must make sure that we also address legacy asbestos, as it is required for us to continue to remain healthy enough to do our job and then hopefully enjoy our retirements. So why is this important for firefighters? Because legacy asbestos is a widely accepted occupational exposure for us. We know that fire liberates asbestos, and the overhaul tasks add tremendous amounts of asbestos fibers to the atmosphere and surfaces that we must work in. So much so that the doctors at the Mesothelioma Center have stated, and I'm going to read this, 3 quotes. Firefighters face uniquely extreme asbestos exposure risks, and as a result, they suffer an elevated rate of asbestos-related diseases. When buildings burned, weakened asbestos-containing materials can release intense concentrations of toxic mineral fibers into the air. And this is what sets firefighters apart from other tradesmen at risk of asbestos. Most occupational asbestos exposure happens little by little on a regular basis. But for firefighters, exposure may come in the form of a single encounter with asbestos-contaminated smoke or debris. So you saw the picture that Linda showed at the beginning. So it's incredibly small how to see 20,000 fibers of asbestos barely cover the mouth of Abraham Lincoln in that penny. So it's not hard to imagine the quantity of asbestos we firefighters get exposed to at any one single fire event. So keep in mind that for decades, asbestos was used extensively in residential and commercial building construction. And this is where legacy asbestos comes into play. Even though asbestos may not be continued to be used today, even though sometimes it is, just legacy asbestos alone remains a clear and present threat to the health and safety of firefighters. So again, given what we know today, it baffles me that asbestos is not public enemy number 1, but we got to do what we can do to ban it and ban it now. And if you've ever seen anyone die from asbestos-induced mesothelioma, Dr. Flores unfortunately has, I have. I don't think you would wish that type of death on anybody. The firefighters like me who answered the call to help 9/11 are the poster children for exposure to what the industry calls allegedly safe, but turned certainly unsafe asbestos. Because even though they allege that it's safe, they say that the application of asbestos is safe because they can't say that their product, asbestos, is safe because everybody knows it's carcinogenic. So they fall back on this game of words that says, well, the application of asbestos is safe. Well, even if that were true, it's safe until it isn't. So like I mentioned, the Twin Towers were the largest asbestos job in the world. While in construction, the North Tower had 40 of its 110 floors covered with asbestos fireproofing. And when they realized this was a bad move, probably somebody realized this pesky carcinogenicity thing was going to come back to bite them, they decided to stop. But rather than remove the asbestos that they had applied in the first 40 floors, they just abated it, which they said it was fine until it wasn't. And that was September 11, 2001, when everybody within a 1.5 mile radius was exposed to asbestos for years. So again, just OSHA says that safe asbestos exposure to a human is 0. So the latency period that Dr. Flores alluded to is going to bring us an asbestos-induced cancer epidemic in the future. And if you're not a firefighter and you're listening and you're saying, well, that's okay, this doesn't apply to me, I want you to think again, because one of the most prevalent exposures that no one seems to talk about asbestos is exposure from brake dust. That's the asbestos industry still applying asbestos to brake pads and liners to reduce heat buildup. So just think how many cars you see out there every day and how often they must apply their brakes. So ever since I learned that, I have never jogged alongside city streets since. So to close, we can't change the past, but Linda and everybody else here, and hopefully all of you guys listening today, can prevent similar future tragedies by advocating by the banning of asbestos. And we can start doing that today. Oftentimes, doing the right thing is unclear. For asbestos, the case is clear as day. It needs to be removed. So let's get rid of it, and let's see if the asbestos industry can put the health and safety of mankind ahead of corporate profits for one time in their lives. Thank you.
Thank you, Dr. Wu. Brent, it's your turn. You're muted. I'd love for you to take on legacy asbestos. With all of this reporting rule, part 1, part 2, it's been in the news. We had a resolution that was introduced and passed. We had a week of awareness. So we've had 3 months of a lot of asbestos questions. Can you dive in, please, and tell us a little bit more in the home schools, workplaces, and around environmental sites, where asbestos is, what do we need to do to prevent exposure? And Dr. Wu, you said it also beautifully. We need to educate our community because it's taking industry a little while to do it for us. But the reality is, what can people know? I'm getting interesting questions like, is there a faster way to abate asbestos? What about testing? So take on asbestos legacy, if you would, please, Brent. You're an expert and you always know just what to say.
Absolutely. Delighted to do that. And in fact, the term legacy asbestos can be confusing to some. So let me try to maybe dive into dealing with that confusion. Specifically, legacy asbestos means that asbestos which has been installed in buildings and currently is there still today. In most cases, all of this asbestos was installed prior to 1980. We have some uses of asbestos that have been banned, and we can talk about those. And in fact, Dr. Wu mentioned some of them. Asbestos containing fireproofing that he mentioned in the World Trade Center. Decorative applications of asbestos, like a popcorn ceiling, is a legacy use of asbestos because we're not putting those in anymore. That's why we call them legacy. Another one that's common is pipe insulation, boiler insulation, tank insulation. Anything that is a thermal system insulating material might also contain asbestos and be a legacy, or what we refer to as a legacy material, specifically in this Part 2 risk evaluation that EPA has come forward with. Some lesser known uses of asbestos that are legacy uses would be drywall joint compound. That's the mud that you put up when building an office or a home or an industrial facility to make the wall look nice. So all the joints have a drywall mud on there. For years, that mud contained asbestos. Floor tiles, mastic used to install those floor tiles. And specifically, we've talked about the firefighters, but imagine what happens in a fire. A floor tile isn't likely to release asbestos fibers. Those fibers are bound nicely in the matrix of that floor tile. But once it's been subjected to fire, and in fact, Dr. Wu, I love these words you used, the fire liberates the asbestos. And it really does, because we essentially turn that to ash. One of the reasons asbestos was used for years was because it's a great fire retardant material. So we may burn the organic material in a floor tile, but be left with the asbestos fibers, which can be inhaled by whoever goes in there. Electrical wires, the insulation on electrical wires, a lesser known use. Fire resistant boards found in electrical closets can contain asbestos. Laboratory countertops, the black coating underneath sinks that you might find. These are all asbestos materials that are legacy materials that I think people don't think about a lot. How do we go about preventing exposure? Let me just rattle off kind of the top 5 things we could do. First of all, be aware of those materials that might contain asbestos, or what we call in our industry susceptible materials. If you see dust that you're not sure if it contains asbestos, don't disturb it. Please don't disturb it, because the damage and the disease from asbestos exposure really comes from inhaling these fibers into the body. If you are in a situation where you're not sure, hire a professional. Bring a professional in. The Environmental Information Association has members all over the country and in Canada who can be called upon to provide inspections and testing for the presence of asbestos. Make sure you're safe. How do you make yourself safe? If you have an area that you suspect might contain asbestos, cordon it off, keep people out of the area. And if you need to go in the area, make sure you're wearing appropriate respiratory and other protective equipment. In short, when the EPA came out with this part 2, one of the things they said were the susceptible populations include occupational exposure. That would include not only firefighters, but heating, ventilating, air conditioning contractors, plumbers, electricians, persons exposed from take-home exposure. That means people in the trades who take asbestos fibers home on their clothes after they've been exposed to these legacy materials. Individuals exposed through do-it-yourself activities, doing a makeshift home renovation project where you don't know you're disturbing asbestos and you do. Children are particularly susceptible, and of course, those that smoke. I think that pretty much wraps it up for my discussion of legacy materials.
No, that's great, Brent. And we're going to continue our prevention work together. And ADAO stands behind EIA, and we do not recommend individuals taking their own samples at home and trying to ad hoc asbestos abatement. And also, I work closely with Greg. We work on natural disaster, preventing exposure after fires, tornadoes, and et cetera. I want to introduce my dear colleague, Greg. Greg, can you we talk about what is asbestos? Where is it? What do we do? Let's shift the conversation to what does Congress and the administration need to do? You're going to focus primarily on legislation. If you would begin, please. Thank you so much.
Thanks, Linda. So from the International Association of Firefighters, which represents 345,000 firefighters, we have partnered with ADAO for the better part of 20 years, because 20 years ago, we identified this as a problem that was impacting firefighters. But more than that, firefighters are members of the community. And we know if it's impacting us, it's impacting the citizens we serve. As you see behind me, there's a picture, and it says on the bottom, which you probably can't read, it says, "I'm not here for me, I'm here for we, and we are here for them." And that them is you, the citizens. We come together to serve the citizens. So from a legislative point of view, the IAFF and ADAO has been working to pass legislation in this current Congress. The House bill is HR 2402, the Alan Reinstein Ban Asbestos Now Act. And in the Senate, by the same name, it is S 1069. This piece of legislation that is bicameral and bipartisan at this point would definitively ban asbestos. And that includes all importations, sales, and future use of all asbestos fibers. So the current situation is this. We have limited regulations, but that only deals with one fiber of asbestos and 6 conditions of use. What we need is a ban, a complete and total ban on all fibers, all 6 fibers in all uses. So many people ask, well, we just saw this news about a ban of asbestos. Well, let's just say public relations is overselling the worth of that ban. That ban is a great ban for one particular fiber, and those 6 uses. We need to expand that. And how we do it is through this legislation that the Alan Reinstein Ban Asbestos Now Act, or R-Ban as we call it. We need to get that done this cycle. Congress will go away, they reset, if you will, the end of December. So we have a short window between now and the end of December to move this piece of legislation, or we'll begin once again. So give you a little history. We were very close in 2019. We were able to get this bill, very similar one, passed out of the House Energy and Commerce Committee with a tally of 47-1. We had one member that voted against it. However, another organization took great strides to block our forward momentum. And unfortunately, it was late in the session, and that essentially killed it for that session. So we were required to restart our efforts. And that is what we have done here, and we will continue to do until we get it to a conclusion. The one nice thing about firefighters, or the bad thing is, we never go away when the fire's burning. This fire continues to burn, so we will be on the front lines until this fire is extinguished, until asbestos is no more. So here, what it does is it bans the importation. We import over 300 metric tons. I believe it was 322, 325 metric tons at the last statistic that was released about 2 years ago. Pardon the pun, but that's a boatload of asbestos. It comes into this country, and then it has to go out to our homeland, if you will. And that goes by rail or by motor vehicle, trucks. And with every potential move of asbestos, that asbestos leaks out of the containers or is potentially involved in a train accident. And then it eventually makes its way into use. And lo and behold, there's an industry accident. While not an industry accident, as a kid, I grew up in Southern California at a Marine Corps base. My father was a U.S. Marine, and I lived on the Marine Corps Air Station in Tustin. That base closed about 24 years ago. But what was left was these ginormous blimp hangars, 1,200 feet long, 20 stories tall. Just this past winter, one of those hangars burned, and it released asbestos into the air, asbestos fibers into the air that covered about a 5-mile radius around that building. That was my old neighborhood. That was the playground I played on, the schools I went to as a kid. And it is still impacting that community. We have to take action today to stop those incidents from happening in the future. What we do today will protect people in the future. As my boss, General President Ed Kelly of the International Association says, he says this quite often, what's in him is in him. We can't change that. And I feel the same. What's in me from my job on the front lines as a firefighter is in me. I can't change that. But what we can change is the future firefighters, the future children playing on that playground that I played on. We can make it safer for them by eliminating asbestos. And the Alan Reinstein Ban Asbestos Now Act does that. Regulations is not the answer. And the reason regulations is not the answer is it's easy to change. It's easy to create loopholes. There's so many regulations out there that they often fly under the radar, and advocates like us aren't aware of those regulations moving through the system, and then we have to deal with it on the back end when it's in effect. So one, we don't prefer regulation over legislation. Legislation first, regulation second. But regulations requires that we be very vigilant and watching for future changes. The other thing is, when you have a change of administration, it's easy for them to reset the agenda and change that regulation. They do it quietly, and we have to be like stealth detectives, always lurking in the background, trying to detect a change that's harmful to us. So That is why legislation is the answer. We need your help. Linda will share a link to a resource page. On that resource page, you'll see some of our efforts from earlier this year. And that includes a billboard that we were able to, well, we joined ADAO in co-sponsoring on Times Square. This electronic billboard brought the issue of asbestos to over 1.5 million people a day for an extended period. We're very grateful to Linda and ADAO for inviting us to join her in that effort. But key to that is it has a QR code on it, and that will take you to our voter voice advocacy page. Through our voter voice advocacy page, you can make your voice heard in the halls of Congress. This is a simple 1 minute, 1.5 minutes to register, and then you will send a email message to your representative and your 2 senators that say, hey, join with us, ban asbestos now. We must do this. We have to do this. Our future generations require us to do this. With that, I thank you for the time, and I pass it back to my dear friend, Linda Reinstein.
Thank you, Greg. That's terrific. And we will put a link to your voter voice in our thank you email. Dr. Flores had to go to the OR, and unfortunately, there are some people that didn't have Zoom accounts that the link was sent. So I'm getting messages. So everyone's this will be recorded and shared. So just apologies when somebody has to watch the delayed broadcast. Next, we have Bob Sussman, legal expert. As you've heard, everyone is tired of, especially Dr. Wu and others in different industries, of trying to fight industry to prevent exposure, to eliminate all diseases. Bob, you've done an amazing job with legal and regulations. Can you, and it's not an easy subject, can you touch on part 1? Because one of the questions coming in is what will part 1 do for me and my home, school, etc.? And what does part 2 risk evaluation mean to the ban asbestos efforts? And Bob, you have great resources, so take it away and please just help us understand and better use part 1 and 2.
Okay. Well, thanks, Linda. I want to start with just a bit of history here. As many of you may know, EPA tried and failed to ban most uses of asbestos in 1989, and EPA's regulations were thrown out by a court in a suit filed by industry. And the result of that was that regulation of asbestos in the US essentially stalled for the next 25 years. However, things changed in 2016 when Congress amended the Toxic Substances Control Act to remove the legal roadblocks that had brought down EPA's 1989 ban. And with the new law giving EPA stronger tools, asbestos became a priority again. And since 2017, EPA has been engaged in evaluating the risks of asbestos exposure and taking action to reduce unreasonable risks. This process is still underway, and it will be several more years before EPA completes the job. So EPA's work is proceeding in two stages. The first, part 1, is focused on current importation and use of chrysotile asbestos. EPA has finished part 1 and just recently issued its final part 1 risk management rule. The second phase is part 2 and is focused mainly on the risks of legacy asbestos. Part 2 is lagging behind part 1 because the Trump EPA took the position that TSCA did not apply to legacy asbestos. And that resulted in litigation which ultimately was resolved in 2019 with a court decision holding that indeed EPA does have an obligation to address legacy asbestos under TSCA. And because of the delay, Part 2 is still at an early stage. In fact, just a few weeks ago, EPA kicked off Part 2 by publishing a draft of its Part 2 risk evaluation. So turning back to the Part 1 rule, EPA has required immediate ban on importation of raw asbestos by the chloralkali industry, the last remaining asbestos importer, and has also required a phase out of the use of asbestos to produce chlorine and caustic soda over a 12-year period. The rule also bans 5 other ongoing uses of asbestos, including asbestos sheet gaskets and aftermarket sales of asbestos brake linings. Now, ADAO has applauded the progress that EPA made in Part 1, but we are concerned that the rule is not strong enough because it does not provide full protection for ongoing exposures and may not, in fact, cover all currently sold asbestos-containing products. ADAO has filed a legal challenge to strengthen the Part 1 rule, and the chemical industry is suing to attack the rule. Now, turning to Part 2, I want to make an important point, which is Part 2 actually covers a lot more ground than Part 1 because there are many legacy asbestos products that are pervasive throughout the economy, as we heard from Brent. And plainly, legacy asbestos is a big contributor to asbestos death and disease. Indeed, probably a much bigger contributor than currently imported and used asbestos products. And we're still pouring through the draft evaluation, but it's pretty clear that according to EPA, the population at risk is quite large, maybe in the hundreds of thousands, and the health risks are significant and widespread. Importantly, the largest dangers seem to be to firefighters and construction workers. A big question is whether the many laws and regulations for handling and removing legacy asbestos are providing adequate protection. I think the EPA risk evaluation is suggesting that they're not, but the evaluation does not comprehensively evaluate current asbestos protection programs. So once EPA is done with the Part 1 evaluation, it moves on to risk management. And then the question will be, what regulations are needed to manage asbestos more safely? I will stop there, except to mention that there is a 60-day comment period on the Part 2 evaluation. That's not a lot of time. There is a lot of information to digest and to analyze. I would say that finding the time to review the evaluation and commenting to EPA is vitally important because it will set the stage for what comes next. Thank you.
Thank you, Bob. And we could put together, hopefully, some of the top points that people on this webinar might be willing to use as they write their comments about Part 2. We only have a few minutes left, and there were over 30 questions that were submitted in advance and some for today. Dr. Wu, thank you for staying on with all of your many demands. I want to focus on the health side of asbestos exposure, which is really important to all of us on this webinar and many who are attending. If you've been exposed to asbestos as a physician and with your knowledge in the fire department, what are the best ways a person who has been exposed, whether it's through cleanup, remediation, however that workplace, what conversations would you recommend a person who's been exposed have with their general physician? Because we have a lack between exposure and the medical community. A lot of people are afraid to talk to their physicians. As an expert in physician, is there any recommendation you could make to those who've been exposed, how to navigate those conversations with their physician?
Sure. So first, it would have to be the temporality of the exposure, right? Excuse me. So if this is an exposure that happened once and it no longer happen again, then we can move into surveillance about what possible ramifications there may be from that single or multiple, but no longer continuing exposure. But if this is an exposure from a tradesman, from somebody that's a handyman, from a firefighter, then the very first thing is the obvious. You need to stop further exposure. And as simple as that sounds, it may not be that easy to do, even for the exposure that just occurred, because as your picture showed, fibers are incredibly small. So a mechanical preliminary exposure reduction, because we don't call it decontamination anymore. Decontamination is a hazardous materials term that should stay in the hazardous material realm. Firefighters can never be decontaminated, because decontaminated by the very definition of the word means absent of contamination, and we will never achieve that with the current technology and standards that we have with firefighter gear. So the first thing is PER, whether you're a firefighter or a construction worker or anybody else, an auto mechanic, anybody else that's at risk of being exposed continuously, PER, preliminary exposure reduction. Then identify the source and stay away from it. Call a mitigating company, and they're not cheap, so see who would be responsible. And then once you're no longer exposed and you have PER yourself to the point that you're comfortable, that you're no longer exposing yourself, friends, colleagues, family, then if you think there is a need for you to be evaluated physically, then by all means, go to your doctor, have a baseline chest x-ray, especially if you have symptoms. You know, as we know, the latency period for asbestos-related disease can be upwards of 40 years. So as I mentioned when I was talking, is the epidemic of asbestos-induced diseases resultant from 9/11 is yet to be seen. Thank you.
Thank you, Dr. Wu. That's very helpful. I'm going to ask one question to the entire panel. If you'll keep your responses briefs, it will have everyone answer. This came in. How should EPA regulate legacy asbestos under TSCA? So that's a highly, that's policy. But let's start with Greg. From your knowledge, how should EPA regulate legacy asbestos under TSCA?
Sure. First off, I don't think TSCA is the right vehicle to regulate asbestos. That would indicate that there's a way to safely handle asbestos. And as we know, there is no safe way to handle asbestos. What we need is a comprehensive law, the RBAN law, and that is the starting point. Once we outlaw asbestos in general, then we can go about mitigating and remediating asbestos through professionals like Brent. And our next step may be to try and allocate some federal grant funding towards those mitigation efforts. But EPA cannot regulate any kind of asbestos effectively.
Thank you. Brent, same question to you. What should EPA do to regulate legacy asbestos under TSCA?
I think that EPA has its hands tied in many ways in terms of trying to regulate legacy asbestos under TSCA. It's already installed in buildings. it's there. EPA certainly can't, through TSCA, and I can, I don't want to get terribly technical with it, but they can't through TSCA require abatement of all those materials. And I think that probably would be the wrong answer to begin with. I think what EPA can do is enforce their existing regulations about requiring asbestos inspections prior to any renovation or demolition. I think they could take those regulatory requirements and push them down to the local community that actually issues demolition and construction permits to make sure that those regulations are followed. I think there's a lot that EPA can do with what already exists. I don't see that EPA is going to be able to regulate legacy asbestos through TSCA. One of the things we do see in part 2 that I think is encouraging is EPA is encouraging that OSHA adopt a more stringent PEL or permissible exposure limit to asbestos of 0.004 fibers per cubic centimeter. That would go a long way from EPA's own research into preventing a significant number of asbestos-related cancers.
Thank you, Brent. Dr. Wu, we're going to close with you, but before Bob, let's think about the gig economy. What could EPA do to prevent legacy exposure in the gig economy that don't have an OSHA or a union? I mean, they have OSHA, but they don't have a union and protection like other workers. Can you make a recommendation?
Linda, who are you asking?
I'm asking you, I'm taking a spin-off from the question about what should EPA do under TSCA with legacy. Let's think about the gig economy. What can EPA do with legacy for the gig economy under TSCA?
Yeah. I'm not sure exactly what EPA ought to do for the gig economy, but EPA does have pretty broad authority under TSCA, and if it finds that legacy asbestos presents an unreasonable risk, as it will, I think, then it's incumbent upon EPA to take actions to mitigate the risk. What those actions ought to be, I think, will require a lot of discussion and analysis. EPA obviously can't ban legacy asbestos. It's there. It's going to stay there. So it's a matter of mitigating the risk, and that is, I think, going to require looking pretty hard at the various programs and safeguards that are in place to see whether they can be strengthened or, as Brent suggests, simply enforced more effectively. EPA is actually, with its other rules under TSCA, is adopting permissible exposure limits itself and enforcing them directly. So I think there's a decent chance that if EPA concludes that the current OSHA level is not protective enough, that EPA will end up setting a more protective level and then applying that level to legacy asbestos.
Thank you, Bob. Dr. Wu, closing with you as a medical expert with all the experience. You've been a very strong voice for prevention and for policy. We now have multiple layers of confusion because of the different rules and announcements that were made in the last 90 days. Some of them are very good, but it has resulted in confusion. So if you had the opportunity to sit in front of, you can pick your official, what's your short message to the government to get this done? Because exposure is continuing, and we continue to talk about risk evaluations and policy movement. At the end of the day, as Greg had mentioned, how many tons of asbestos are imported. What's your message to high-level government officials about mitigating and eliminating asbestos risk?
Well, to sum it up, I'm 100% of agreement with the other panelists here. It needs to be legislated. It can't be regulated. We've already tried that. It hasn't worked for decades. So whereas asbestos is a phenomenal fireproofing agent because asbestos simply does not burn. So when it was discovered that it doesn't burn and it would make a phenomenal fireproofer, then we used it. But then we realized that it's carcinogenic. So why do we continue to use it when other known carcinogens are no longer being used? And I'm talking about iridium for light illumination, DDT for insect repellents, Agent Orange for plant defoliants. So they were all great at what they did, and they still are, but we no longer use them because they're carcinogenic. So we know the same thing about asbestos. So why are we continuing to use it? So from a health, safety, and medicine perspective, the answer is simple. It needs to be banned, and it needs to be banned yesterday. Thanks.
Thank you, Dr. Wu. I want to thank all of the panelists for giving their time, giving more than their time, because we go to Washington, we work on conferences, we do a lot together. So ADAO sincerely thanks you for bringing your knowledge to the forefront. I know this won't be the last webinar we do, but this will conclude today's webinar. Thank you so much to the panel and to the attendees. And for those who had technical difficulties and will have to watch the recording, thank you for your patience there too. This concludes the webinar today. Thank you.